Hello everyone, this is Brainless Medico and I am Dr. Manoj, and today we are going to see one more topic under rheumatology. So let's go with the case. An elderly patient presents sudden onset painful swelling of the knee or wrist. It looks like gout, but the cause is different. So that is my word. The cause is different. So what may be the condition? Pause the video, just think. Yeah, that's right. Pseudogout. In the name only it is there. It is pseudo, looks like gout, but not gout. Okay, why it is not considered under gout? So let's differentiate why it is not an actual gout. So the topic we are going to study, you already know, pseudo gout. I added this topic or this point just in the name itself because this is what it differentiates it from gout. Okay. Calcium pyrophosphate deposition disease. It is also called as calcium pyrophosphate deposition disease. Okay, so definition goes like this. It is also called as I said, calcium pyrophosphate deposition disease. Why it is called like that? Because it is also one of the crystal-induced arthropathy caused by deposition of calcium pyrophosphate dihydrate crystals. Yeah, it is big. You can remember CPHC. As of now, in exam you need to write full. At least you need to write calcium pyrophosphate crystals. What? Okay, pause the video. Just think, what will be the deposition of content of the crystals in gout? Use the comment section. I'll be checking it, right? In the gout. Then CPHC in the joints leading to acute and chronic inflammatory arthritis, just like a gout. Pathogenesis, you are going to see abnormal metabolism of, obviously there will be abnormal metabolism of pyrophosphate which leads to deposition, right? Formation and deposition of calcium pyrophosphate crystals in cartilages. There it was in the joints. Here it is crystals in the cartilage. Crystal induced inflammatory disease. Okay. Then coming to risk factors, advanced stage, osteoarthritis, hyperparathyroidism, hemochromatosis, hypomagnesia, then hypothyroidism. Risk factors are completely different from gout. You just go and watch. If you have not watched gout, after this video you are going to differentiate both, and I'll be making separate video on this topic, differentiating between gout and pseudogout. You can go and watch if it is uploaded. Then clinical features, as in the gout we studied acute and chronic. Even here it is acute and chronic. Sudden onset joint pain and swelling commonly involves knee, wrist, shoulder and ankle. Redness and warmth over the joint. Fever may occur. There also it may be there or not. Okay. Then coming to chronic, we are going to see chronic arthritis mimicking osteoarthritis or rheumatoid arthritis, joint stiffness and reduced movement. Then coming to investigations, you are going to see, as I discussed 2 to 3 times, it is rhomboid shaped. There it was needle shaped, right? Rhomboid shaped calcium pyrophosphate crystals will be seen. Where you are going to see the crystals? In joint aspiration, don't forget it. Crystals show positive bifringes. It was negative in gout. Don't get confused. It is positive in pseudogout. Under polarized light. Then X-ray shows chondrocalcinosis. There it was something different. Use the comment section to comment, right? Then coming to inflammatory markers, it is also elevated in both. Then coming to management, gout management is very important. I just made a separate video on the management of gout. Here it is not that important. It's just a normal management, symptomatic management. So let's see. Acute pseudogout, you're going to see NSAIDs, colchicine, intra-articular or systemic corticosteroids. Intra-articular, you're going, there are so many diseases, you are going to just give steroids in the intra-articular. If you want, I will make a separate video. Just use the comment section. Then chronic condition, you are going to give low dose colchicine for prophylaxis, management of underlying metabolic disorders. Then coming to complications, recurrent acute attacks, chronic joint pains and reduced joint functions. And we are here for the examples. Knee is the most commonly involved joint. You need to remember what are the crystals shape. Rhomboid shaped. What is the difference? Positive bifringes. X-ray shows chondrocalcinosis. Serum uric acid levels are normal. Why I added this point is like, you need not to confuse with the gout. Yeah, there is one condition where your serum uric acid levels won't be altered in the gout. Yeah, you can answer that in comment section. Quick recap. Here I am going to read just full complete line as it is. So you need to remember. Pseudogout is crystal-induced arthritis caused by calcium pyrophosphate deposition, commonly affecting elderly patients and presenting as acute painful arthritis resembling gout. So let's quickly revise the topic. Pseudogout, it is also called as calcium pyrophosphate deposition disease, crystal-induced arthropathy caused by deposition of calcium pyrophosphate dihydrate crystals. Yeah, it's like big. You need at least to remember calcium pyrophosphate crystals, leading to acute and chronic inflammatory arthritis. Pathogenesis or excess deposition will be seen, which leads to inflammation of the joints. Risk factors, these are completely different from gout. You need to remember separately. A, advanced age, osteoarthritis, hyperthyroidism, thyroidism, hypothyroidism, hyperparathyroidism, hemochromatosis, hypomagnesemia. Then coming to clinical features, it is acute and chronic. Just go through it if you want one more time. Investigations, joint aspiration, you're going to say rhomboid shaped. I'm stressing again, rhomboid shaped, not needle shaped, rhomboid shaped calcium pyrophosphate crystals, positive bifringes under polarized light. What shows positive bifringes? These are crystals, okay? Then X-rays, you are going to see chondrocalcinosis and inflammatory markers. Obviously, there is inflammation, there will be elevation of the inflammatory markers. Then management, you are going to give NSAIDs, colchicine, intraarticular or systemic corticosteroids in acute gout, acute pseudogout. Yeah. In chronic condition, you are going to give low dose colchicine for prophylaxis. You need to manage the case long term. So if you are giving high dose, the patient may face the complications of the drugs. So you need to manage that also. For long term, you are going to give long dose. Sorry, slip of tongue. Low dose. Management of underlying metabolic disorders. So what are the complications? Recurrent acute attacks, chronic joint damage, reduced joint function. And there goes your examples. If you want the PDF, you can just use the comment section. Like, I want the PDF, I'll be DMing you, or if you give the personal details. Then that was for the video, and don't forget to subscribe. Thank you.